Hospice care. People think they know what hospice is, but on today's program, you're going to find out some of the nuances of what hospice is really all about. I'm Reverend Dr. L. Ronald Durham, the Community Relations Coordinator for Halifax Health Hospice. Today our discussion is going to revolve around hospice care, and in particular we're going to focus on our care center in Orange City, and my special guest today is Dr. Lyle Wadsworth. He's the medical director of that facility. Hello, Dr. Wadsworth. How are you today?
Hi, Dr. Durham. Good. Thank you.
It's good to have you on the program. I wanted to get right into some of the things that people may not have a good understanding when it comes to what hospice is really all about. So can you just tell us briefly what hospice care really is?
Hospice care is comprehensive, compassionate care of individuals with life-limiting illnesses. It's an expert medical care in the management of pain, of emotional, of spiritual issues. The majority of this care is given at home with a family in attendance. Hospice started around the turn of the century, meaning the turn of the 20th century, but it was actually codified and organized into a system of care by Dr. Cicely Saunders, an English physician in England, in 1967 at the famed St. Christopher's Hospital in London. This was St. Christopher's Hospice. The late Dr. Kerman heard a speech about this concept in Connecticut in 1974, where it was started, and brought this to Volusia County in 1979. So Dr. Kerman started the first hospice here in our county, the Hospice of Volusia Flagler. The name was later changed to Halifax Health Hospice, and that is what we are today. Hospice operates on the principle of respecting patients' beliefs, their values, and their goals. Hospice is patient and family-centered. We use an interdisciplinary group. There are many professionals involved with the care of our patients. We have nurses, home health aides, chaplains, social workers, certainly doctors and volunteers, all necessary for the excellent care that we want to provide at this very vulnerable stage in people's lives. About 40% of deaths in the United States occur on hospice. Now our hospice, Halifax Health Hospice, is a not-for-profit hospice and has always been that way. And we give away a great deal of care. Approximately $2.4 million of unreimbursed care is given back to the community. This is free care and services. Some of these services include uncompensated care. We care for all people, regardless. We have household support for individuals who need some additional care. There is a bereavement and children's program. As you can imagine, the children would have a very difficult time with the loss of a parent or grandparent. There's a veterans recognition program that we have. We want to pay respect to our men and women who have served in our country. We have a traumatic loss program for individuals who have suffered a loss of someone who has been murdered or a terrible accident. We have family caregiver programs. And all told, we give away about $2.4 million to our community. That is of last year. Now, to be admitted to hospice, a person needs to have a life-limiting illness. Generally, that means a physician feels that if the disease runs its normal course, it would be expected that that person would live about 6 months. Those diagnoses could be cancer, heart disease, lung disease, liver disease, neurologic disease, to name just a few. Thus, hospice is a medical specialty, just as a person would want to see a gastroenterologist for a stomach problem, or a cardiologist with a complex heart problem, or a neurologist with a neurologic problem. People at this stage who have serious illness would be referred to a hospice. And these are highly skilled individuals who are trained to give the very best in care to those with life-limiting illnesses.
That's excellent, Dr. Wadsworth. Now, explain this to me. I'm a family, I have a person who is ill. Why would I select hospice care versus some other method?
All of us have experienced death of someone we love in our families. Most of us who work in hospice, as you do, have experienced death of which we've had family members on this hospice. I have experienced it 3 times in my own family with Halifax Health Hospice, and it's probably why I was drawn into this ministry. What makes hospice so special, in my opinion, is the collaborative approach that we have. We have this team of well-trained individuals who are highly trained with complementary skills for the patient's benefit. And we've named them, all the staffing that we have. And then many of us have advanced training. Doctors have advanced training in hospice and palliative medicine. And many of us have worked in hospice, did the studies, and have passed national certification programs, examinations in hospice. In fact, Dr. Zimmerman and myself passed the examination in 2008. Dr. Zimmerman is our medical director. And I believe we were the first 2 in this county to have that certification. So we take a great deal of pride, and we want to give excellent care to our patients. Hospice is available 24/7 to meet our patient needs. And these needs are met in their home, which is where most people would say they want to be, nursing homes, assisted living facilities, and at times when needed in the care centers that you mentioned. A medical doctor is always on call, just as chaplains, just as licensed clinical social workers, and nurses. So this team then focuses on the total person. Pain and other symptoms that need to be managed, psychosocial issues that need to be resolved, spiritual issues, all combine into the total person, and the family helps that patient and the families work through this. And as you know, this is a very difficult time in the life of a person as well as his family. And then after death, we have a bereavement program to assist families in that process and comfort them during a very vulnerable time.
So, Dr. Wadsworth, then, as the medical director at our facility on Veterans Memorial Parkway in Orange City, what are your goals for Halifax Health Hospice in the upcoming future?
Well, it's always patient and family centered. The goal then is for this last journey in a patient's life to be comfortable. We want the family to remember this, as painful as it is, as a good experience. It's critical for them to be able to think about the person that they love so deeply, that person was comfortable, that they were loved, that they were respected, that they were supported, and their symptoms were controlled, and it was done with dignity. And with good hospice care, which I think we provide, the person and the families are more at peace, these symptoms are better managed, and these burdens are lifted. So the goal is fairly simple. It's this expert and compassionate end-of-life care for the patient and the families.
Well, let's get to a little bit of your personal background. Tell us a little bit about your medical background and what actually was it that drew you into specializing in hospice care?
Well, I'm a local. I'm a graduate of Mainland High School in Daytona Beach, and I'm a graduate of Stetson University. And I left the DeLand community, as we called it then, Dead Land, for 6 years, actually 7 years. Never thought I would come back, but I came back. I went to Vanderbilt. I was trained as an internal medicine specialist, came back and practiced that specialty. But as the years went by and my patients began to get older, I realized that geriatrics was an integral discipline, important discipline I needed to learn about. So I studied geriatrics and became board certified in that, as well as internal medicine, and that was 1988. But later it became clear to me as I matured that many of my patients did have life-limiting illnesses and they were dying. And about that time, the hospice movement was beginning in Volusia County, and there was a big knowledge void with so many doctors. There were no hospice doctors in West Volusia at that time, and I felt there was this need. So I did additional study in hospice and became board certified, as I mentioned, and I began working with one of the teams at the invitation of Halifax Health Hospice. And I currently now oversee 3 separate teams, and these about 180 patients, and these teams are the people that I mentioned, the various team members who go into homes, nursing homes, assisted living facilities. Our care center that you mentioned, where I serve as a medical doctor and director, was opened in November of 2007, so we're about 7.5 years into it. I have taken care of about 5,000 patients at that center now. And it's very difficult work, to be certain, but death is a part of life. Many years ago, a wise physician said, the role of a physician is to cure sometimes, relieve often, but comfort always. And that's what we do in hospice, day in and day out. And for me, from a personal standpoint, and this is my 37th year in practice, hospice is a calling. It's a ministry. To be able to kneel at the patient's bedside and to hold his hand and to offer a shoulder for a wife of 70 years to cry upon and to comfort and relieve the symptoms of that person that she dearly loved and be with them the last few days in that person's life has been most rewarding and fulfilling. And that actually happened 2 days ago. And even though hospice is a medical specialty in which we constantly face death, we also celebrate the sanctity of life. And if it's God's will, I will be serving in this capacity for many years to come. It has truly been a blessing.
That's great. Now, I've been fortunate enough to come to the center in Orange City on Veterans Memorial Parkway. It's a beautiful facility. One of the things that strikes me about it is the chapel. What are some of the other things inside the facility that you could share with our audience?
Well, okay, well, I will describe it. Halifax Health Hospice has 4 care centers now. One in Port Orange is where hospice started, and then we were the second in Orange City. We have 18 beds, fairly large facility. There's one in Edgewater, covers our southeast, and now a brand new, beautiful facility in Ormond Beach. The care centers are all different, but they're all beautiful. They're cheerful, they're well appointed. We have children play areas, there are pianos, and you mentioned chapels. Now, most of us, if asked, where would you like to spend your final days? 90% of us would say, we want to be at home. But in reality, 70% of us die in institutions such as nursing homes or hospitals. Well, hospice then comes along beside the people to allow them to stay home with their loved ones as much as possible. And most of our care is done in homes. However, sometimes it's very difficult for families to keep the loved one at home, and for a number of reasons, we may not be able to do that. For instance, symptoms may not be controlled. Their symptoms are escalating. There's lack of caregiver support at home. Family feels overburdened, and there's a great deal of discomfort watching this person die at home. So the care center comes along beside the family, and that people come into the care centers. Now, you've been in them, and they are absolutely beautiful. And as you come in our care center, first of all, the external is beautiful. It's surrounded with woods, so it's a very relaxed atmosphere. There's a large room in which you're greeted, and then you come into a great room. It's a living room, beautifully appointed with a grand piano, and often we have volunteers who are playing music that goes throughout the facility. We have a saltwater aquarium that gives a relaxing touch. There's a children's playroom to the right. Sometimes I've had my grandchildren with me when I've rounded there, and I could put them in the playroom while we did this. But as you can imagine, parents or grandparents come to visit someone, and we have some place for them to go. We have 3 different wings, all exactly alike. Each wing has 6 rooms. There is a family room, so families could meet. There's a large outdoor porch for them. And then their patient rooms are large, spacious rooms. Families can sleep there if they wish. There are pull-out couches. Each one has its own porch that overlooks a wooded area. The staff are constantly present for them. We look at this as their home away from home. And when we enter the room, we see this as their room. It's not the same as a hospital room. It doesn't have that sterile feel. The patient is treated with dignity by a highly skilled team that we've mentioned. They have the home health aides or the nurse assistants who are checking on them, certainly nurses. Each patient is visited by a chaplain if they desire, but we offer that. Each person is visited by a licensed clinical social worker. And then I usually round 5 days a week, and I have an associate who helps relieve me when I'm gone, and he goes 1 or 2 days a week. So that the patients get a great deal of hands-on care when they come in there. And the whole idea is to make this very difficult situation as palatable and as pleasant as we can. By being in the care center, we can immediately change medication regimens. We can address symptoms of pain, of anxiety, shortness of breath, other painful situations. But it also gives us time to address psychosocial issues, be involved with wills if need be, or advance directives, or funeral preparations if need be. There may be some spiritual issues that need to be reconciled, or there is a chaplain, military, give a pin and a plaque commemorating their service with family present. And it's a very moving experience for the family that we get to see and enjoy with our people. So the whole thing is celebrating this person's life to edify them, to edify the families, for them to understand that this person had meaning and purpose. Our desire then is for the family to have a comfortable time, enjoy this wonderful home away from home, to incorporate all these specialties that we have. And hospice is a medical specialty, just as we mentioned before, if you see a cardiologist or a gastroenterologist, we have a special team that comes along besides the family's doctor to offer additional assistance in the care center that we might take care of them to give the best care that we possibly can.
Well, thank you for that. It sounds like Halifax Health Hospice has certainly thought of everything that could assist not only the patient, but also provide for the family to have a lot of comfort and compassionate care as well. I think one of the things that I get asked about in the community quite often is, what is the cost of hospice care?
Okay, yeah, I get asked that too. Generally, there is little or no charge to the family. Medicare and Medicaid recognize the services of hospice, and most private insurance companies do as well. The services that are covered are those that are directly related to the illness, for instance, of lung cancer or heart failure. Those types of medicines or equipment that's necessary would be covered. Medical equipment, such as beds at home, oxygen, bedside commodes, all these things are provided. And we, again, because Halifax Health Hospice is not for profit, are able to take people who really have no means of care at this stage when they're imminently dying. We've had people who live under bridges with horrible life-limiting illnesses to be able to bring them in and to provide that care for them, to give them meals, hot meals, clothing, and to give them a dignity that they may not have enjoyed in the last few phases of their life. And this is all at no cost to them. This care for hospice, it is covered in the care center certainly, but is also provided at the home, and most care is given at home, nursing facilities, and assisted living facilities.
Now in terms of their community involvement, Halifax Hospice community involvement, there's a significant amount of dollars that Halifax Health Hospice puts back into the community as well, is there not?
Right. And I think that was we referred to that earlier, is about $2.4 million, and that's part of what I was going through. It is a significant amount of money to be able to cover these people. We don't have stockholders, so monies that are donated to Halifax Health goes back into the community to care for these people, many times when no one else is there to do that. And we do that for them. The bereavement program, we have a bereavement program and where we work with families after a death, and I've had patients who have had children that have died tragically, not on hospice, and our hospice offers bereavement for that family even though they've never been connected, because they see that as part of what they do, part of their ministry in the community. Again, unreimbursed care.
Well, Dr. Wadsworth, you have done a tremendous job today. I think the viewing audience has a much clearer picture after your presentation on what hospice care is really all about. I want to thank you for taking the time to share with our community the things that can benefit them and their families when it comes to what we provide at Halifax Health Hospice. Thank you so much.
Thank you. And this is a passion. I love this. This is wonderful work that we have that you and I get to co-minister in. This is a wonderful hospice, and I've told my staff many times, I'll be happy for them to take care of me, but not just yet.
All right. Thank you, Dr. Wadsworth. If there's anyone who would like further information on what Halifax Health Hospice offers, let me take this opportunity to share with you our toll-free number. It's 1-800-272-2717. That's 1-800-272-2717. If you feel free to get on the internet and look at us online, just go to halifaxhealth.org/hospice. That's halifaxhealth.org/hospice. Thank you for your time. Hope you've been educated on hospice care.